Hi, this is Dr. Robert Dowse with Premier Pediatrics, and today we're going to talk a little bit about measles, especially the vaccine, MMR. There has been a recent outbreak of some pockets of measles in southern Utah, including right here in Cedar City. There have been a report of several, and we know for sure all throughout southern Utah there are pockets of it. Unfortunately, this is because of the unvaccinated population, which doesn't give us quite the immunity that we need as a global community. It's called herd immunity, and we need a certain percentage, about 94% to 95% of the population needs to be vaccinated. So what is measles? Measles is a virus that can cause quite horrific morbidity, in other words, sickness, illness. It causes a dramatic cough, rash, fever, just a feeling of just demise. It's just an awful virus. And therefore, vaccines have been made for it for multiple years, and we've had great success with it. It's a very safe vaccine, one of the safest vaccines in all of the world. And it does not cause some of the multiple problems such as autism and different neurologic diseases as was purported back in the 1990s. So we know it's a very safe vaccine. It's one of those vaccines that is given at 1 year of age instead of earlier for children. And the reason for that is because the majority of children are born with a passive immunity to measles in their bloodstream, which lasts for up to about a year. Now we know from studies that about 6 months into a child's life, that passive immunity starts to wane a little bit. But by the time they're a year old, it's enough that we can go ahead and feel confident that the measles vaccine will give them the better immunity. Now, many studies have been done about this, and we've learned that at children that are given the vaccine at 1 year of age, will have about a 95% chance of building immunity to MMR. So about 5% will not. And so that's the reason we give another one at the age of 4 to 5, because that 5% needs to have a second chance to get their immunity up. About 1% of all the immunized people in this nation against measles will never build an immunity, and that's the reason why we need to make sure the children are given both their vaccines by the age of 4 to 6, because the bigger the immunity, the better chance those who cannot build an immunity and those who are underage can be protected against an outbreak of measles. Now, I've had questions from moms saying, well, since we live in an area that has lots of measles, can I give that vaccine prior to 12 months of age? The answer is technically yes. The CDC recommends waiting till 1 year, but there are times when we as physicians will give the vaccine between 6 and 12 months if there's a known outbreak right there, like in that daycare or right there in that community that they're living in. It will work, but even if we do it at that age, we still have to give another vaccine between 12 and 15 months, and the third one then between 4 and 6 years. So it is something we can do, but it's something that we try to reserve for specific isolation pockets. Some people will leave the country with their 6, 8-month-old infant in an area of the world that has a lot of measles, and so they too can get that vaccine. So this is the one exception to the rule. So if you have that concern and you feel like that's the vaccine that you need for your child between 6 and 12 months, please feel free to contact your pediatrician and make sure that they're up to date on that possibility for you. Another question is, do moms who have already had 2 doses of vaccines in their life need to get another vaccine because of the outbreak? And the answer is no. They should have plenty of immunity that lasts for a lifetime. All of us should. So those are kind of the basic questions I've been getting from parents and some of the obvious responses that need to be given. I also think that you just have to be so careful with, of course, just good hygiene. Remember that measles is contagious for up to 4 days after you catch it before you even start showing symptoms. So for 4 days, you could be walking around spreading measles, not even knowing you have it. So if you are unvaccinated or you are a known person that does not have active immunity against it, please be careful if you've been in contact with anybody that has measles, because you can spread it for up to 4 days before your symptoms even show. Okay, this is Dr. Robert Dowse. Thank you very much.